Ladies and gentlemen, the President of the United States, accompanied by the Vice President of the United States.
Oh, this is going to be fun. Oh, and you guys don't get walkout music.
Thank you very much. Thank you.
Uh-huh. This is, yeah, super good. All right. It's windy, and they decided to be outside. By the way, after this nonsense, depending on how long it is, I can't see it going on for very long. Otherwise, he'll suggest everybody spray Raid on potpourri and smoke it. He met with, quote, industry leaders. That's where he went, I love everybody, on online. And when he said, I love everybody, the general BS we'll see in a minute. He's going to repeat a lot of the same things, but he met with like the head of Kroger and Rite Aid and all these things, and they're going to be making an announcement today, and which means they're probably going to be playing an ad on those two monitors, which have skirts. But here we go. Let's just dive in, and then I'll tell you about the. I just love the end of the last one. You can just see like his press office screaming at the press to get out of the room as soon as he's done talking. Was the movie reference Full Metal Jacket last night? You mean in gamey time? Or, oh yes, when I was on streaming? Yes, it was. Thanks, Andy Angels. And hi, everybody. And welcome. And thanks for super chatting and Patreon and all that fun stuff. And happy Monday. And oh, boy.
Today, I'd like to provide you with an update in our war against the coronavirus. Thanks to our comprehensive strategy and extraordinary devotion to our...
He seems quiet today. They had one mic out at the other thing, so I'm going to see if I can turn that up a touch.
Citizens, we've had such tremendous support all over.
Yeah, everybody's supporting you by staying home.
Continue to see encouraging signs of progress. Cases in New York area, New Orleans, Detroit.
Thank you, Lisa Mia Moore. And by the way, he's going to tout the can we just real quick, before he starts talking, we're at 56,527 deaths. And this is, just to be clear, this is total COVID tests per 1,000 people. We're the red line, and Italy is the green line. So when you hear about it's not even close, I want you to keep that in mind. You hear me? You hear me? Just, oh, look at that. Well, thanks for the super chat. Look at that.
Boston and Houston are declining. Denver, Seattle, Philadelphia, Washington, D.C., Atlanta, Nashville, Indianapolis, and St. Louis.
We love it.
Are all stable and declining. All parts of the country are either in good shape, getting better, in all cases getting...
That's not true. They're not in all cases getting better.
Better. And we're seeing...
No, there are places that are just coming online, dummy.
Very little that we're going to look at as a superseding hotspot. Things are moving along.
Moving along.
A horrible situation that we've been confronted with, but they're moving along. As we express our...
Which horrible? Having a president that suggests injecting window cleaner into your lungs?
Gratitude for these hard-fought gains, however, we continue to mourn with thousands of families across the country whose loved ones have been stolen from us by the invisible enemy. We grieve by their side as...
Thank you, Hal Vickery.
One family, this great American family, and we do grieve. We also stand in solidarity with the thousands of Americans who are ill and waging a brave fight against the virus. We're doing everything in our power to heal the sick and to gradually reopen our nation and to safely get
Thank you, Natalie.
Our people back to work. They want to get back to work, and they want to get back to work soon. There's a hunger for getting our country back, and it's happening faster than people would think. Ensuring that...
What, the hunger is happening faster, or the getting back is faster? A lot of people think it's happening faster than would be prudent.
Health of our economy is vital to ensuring the health of our nation.
Is it hazy in the Rose Garden today? Honestly, this is like, did they hire the cameraman from the X-Files?
goals work in tandem. They work side by side. It's clear that our aggressive strategy to slow the spread has been working and is saving countless lives.
Oh, has it now?
For those who are infected, we've taken unprecedented action to ensure they have the highest level of care.
No, precedented. Completely precedented. There's precedent all over the globe. Italy is precedent. South Korea is setting a precedent. Germany is certainly setting a precedent higher than ours. Lower death rate. Go figure.
Anywhere in the world, the federal government has built more than 11,000 extra beds, shipped or delivered hundreds of millions of pieces of personal protective equipment, as you know. In fact, some of the people here are going to be talking about it. Some of our greatest executives, some of the greatest anywhere in the world.
Great. So they all came just to visit and get a, did they all get tested? Did they all, please, each one of you, somebody ask each of those people if they got a COVID test when they came to the White House.
Distributed over 10,000 ventilators, and we now have, in a very short period of
By the way, this is not Lysol or any kind of cleaning fluid, for the record.
time, many have been delivered, and hundreds of thousands are being built. And frankly, every governor has more ventilators right now than they know what to do with their act.
They have no. They're sick of ventilators. You can't spit without hitting a ventilator. New super chat is sure annoying. Is it? I'm sorry, Gary. Apologize.
Shipping
But
them
thank
to
you.
different locations, and we're shipping some to our allies and others throughout the world.
Well, then apparently they do know what to do with them. I guess. See, if you have too many, and someone else has too few, one of the things you know you can do with them is give them to somebody who has too few. So maybe they do know what they're doing with them.
Because we have ventilators, like the job that they've done in getting this very complex piece of equipment built
Oh my God, please tell us how it's like a car.
is actually incredible. You don't hear about ventilators anymore except
Yeah, except from you. I built all these goddamn ventilators and I can't get a single. No one gives me credit for ventilators because everyone wants to get tested so they can have their lives back.
in a positive way.
Super chat noise decreases all seriousness. Love it. It interrupts the series. I think that's wise.
We've launched the most ambitious testing effort, likewise, on Earth. The United
Have we? Have we? We have. See, folks, I do my homework because I love you, and I'm not just going to let him come out here and wag this bullshit around. Is there a lack of precedent? Because these little countries that are doing okay, like which one is that one? That's Turkey's leveling off how many they're doing. No, that's Turkey. Turkey is in line with the United States. They're tracking almost exactly. They're just slightly below per capita for them. But Turkey includes the Syrian border and all kinds of crazy areas where there's literally no way to measure the human lives, like births and deaths in those areas with any true viability. So the fact that they're within pistol distance of us should tell you a little something. Just saying. Yeah.
States has now conducted more than 5.4 million tests, nearly double the number tested in any other country, more than twice.
Yeah, but not per capita, not per 1,000 people in the country. As a matter of fact, we're getting our ass kicked by a way smaller country. Italy, a country you'll recognize as having a bigger economy than Russia, but for some reason we don't talk to their prime minister every other week. Why is that? Huh?
As much as any.
I mean, they make more money, they do more stuff, they're more important on the world stage economically than Russia. What is it? I can't. Maybe this man can answer.
The country. Think of that. Moments
I'm thinking of it right now.
ago, I came from a meeting with some of our nation's largest retailers, including Walmart,
Oh, list.
Walgreens, CVS, Rite Aid, and Kroger. We're
Did you shake their hands? Did you lick your palm before you did it?
joined by the leaders of those great companies, and we also
You mean the CEOs? Yeah.
have with us the leaders from the world's top medical diagnostics companies and suppliers: Thermo Fisher, LabCorp, Quest, U.S. Cotton, and the American Clinical Laboratory
U.S. Cotton? Okay.
Association.
Yeah, this is... I'm not using sarcasm. I'm using verbal irony.
The great companies.
Yes, this is live.
These private sector leaders, along with others such as Roche, Abbott, Becton Dickinson,
Oh, my God.
Logic, and Cephahide,
Sefa-fefa-hefa-hi. Habaran-hana. Kanapana-pana. Sefa-hefa-hefa-hi. Oh, their CEO is pissed right now. You managed to cough up Kroger. Wait, do that again.
Logic, and Cephahide.
Sefa-fefa-hi. Anakanapana-pana.
Have been exceptional partners.
Wait a minute. How have they been exceptional partners if you can't even say their name? How does Sefa-hi?
In an unprecedented drive to
Just going straight. He just blasted through it. I'm not going to roll back and Sefa-hi.
expand the state's capabilities and our country's capabilities.
I can't wait till the CEO of that company comes up and actually pronounce it. I don't know what the shit he's talking about. So I don't know what the name of that company is.
The job they've done has been incredible. The testing
Thank you, Philly Dana.
that's been
Dr. Huffhar. Thank you, Guido Day.
developed
Who is the CEO of Cephahafafavo? Is it Dr. Huffhar or is it Ann Melmahay?
and being developed right now has been truly an amazing thing. I want to thank Abbott Laboratories for
For their 15-minute test that you says is instant.
the job they've done. I want to thank Roche, and in particular, those two have really stepped forward. Abbott with a 5-minute test
15.
that people can take, and in 5 minutes they know what the
15.
answer is. I'd like
15.
to ask, if I could, the executives of these great companies and
And whatever those companies are. Krahager and Ritide and
really helped us a
Mar.
lot over the last 45-day period. We're talking about a 45
I don't know what he was trying to say, Natalie. I honestly don't know what that was. I don't know that.
day period when many of us met, and since then,
I don't doubt it's short because he's not going to be taking a bunch of questions. Is anybody going to ask the Rite Aid CEO if they've had a run on Clorox?
what Walmart and the others have done has been nothing short of amazing. So I just want
No, it's just kind of. It's impressive, I suppose. Whoops, my camera went out. See, I'm working on replacing it, but everything's on back order. I don't have a problem with these companies helping, but it's pretty much par for the course, right?
ask them to come forward.
Yeah, I'd like to thank Abbott Laboratories for being pronounceable. I could say Abbott.
And say a few words about their company. Plus, they're going to make a big contribution to
Are they going to hold a giant check? Are we at that point of the presidency? Is this the last episode of the British office?
our country. Please come forward, please. Thank you. Come on. Thanks.
Don't touch it.
Thank you, Mr. President, and thank you for all of you for being here today. And what we'd like to talk about is the progress we made. The last time we were
Being here today, it's the White House.
here was March 13th, and we've made tremendous progress. And none of that progress could be made without the 47,000 people at Quest Diagnostics that are working around the clock.
Probably true. You mean you don't have any superfluous employees? How is that possible? I bet you could drop a couple of people from management and it would have slowed everything down, huh? How about Gary? You don't need Gary. He's a jerk and nobody listens to him. His ideas are dumb. Kick him to the curb. Save your company some money. But the cleaning crews, they're necessary.
Working up the test and running the test and delivering the results that we need. As far as results,
Now, I understand that one of the tests involves, and I've heard this, blasting people with laser beams and injecting Windex into their lungs. Is that,
we made tremendous progress.
It makes your brain die last. I don't mind.
We are currently at Quest Diagnostics testing about 50,000 tests per day. We've been pushed by the task force to bring up that number. By the end of May, we'll have 100,000 tests per day, about 3 million tests. And these are the molecular tests that we do today. We've also...
Great. Still way behind, not enough capacity. Why aren't we using the DPA to make other labs do this? Cool.
Brought up serological testing. We started that this past week, and by the end of May, we'll be close to 250,000 a day, about 7,000 a month. So you put those two numbers together, it's about 10 million tests by the end of May that we'll be doing at Quest Diagnostics. We're doing that also in a quicker way. Turnaround times were...
Yeah, the PCR tests versus the blood tests are for different things, too. You're not going to be testing who's carrying it. You're going to test who's got it. Both are functional and important. They're not the same thing, though. And strategically, they mean totally different things.
Somewhat of an issue.
Yeah, we're not using the Pentagon labs because they're busy, you know, aerosolizing anthrax and putting it on bullets.
Days. We've reduced that to 1 to 2 days. Our turnaround time for people in beds, hospital beds, is less than 24 hours. And we're doing that in the same way we've done it with the FDA and with CLIA, delivering the quality that you all expect. And convenience will improve as well with convenient solutions that will be able to swab individuals more easily and also deliver to consumer, the ability to have consumers choose a test online with a telehealth provider. So with that, I'd like to offer my colleague.
Is there teleswab? Are we teleswabbing people now?
The podium as well.
Yeah, 7,000 a month would open one meat packing plant. Yeah. Or protect the people who work at 2 hospitals for a week.
Mr. President, thank you very much for your leadership and for having us all here today. Our scientists and our lab technicians are working day and night in order to do as many tests as we possibly can for the American public and to turn those tests around as quickly as possible.
Of course.
Just 45 days ago, we said we could do several thousand tests a day. We can now do 60,000
That sounds fairly vague.
tests a day, and we're continuing to expand that capacity every single day. In addition, our scientists are working to make testing more convenient and easier. We have the swabs now that are much smaller than the original ones that we originally launched with, but we also have the Pixel by LabCorp at-home test. That test right now is for healthcare workers on the front line and first responders, but we will be rolling that out much more broadly over the coming weeks.
So buy our stock, folks, because we're going to be the folks.
We're going to roll it out.
Yeah, tell us, Rob, you just sneeze onto your iPad?
With absolutely no upfront cost for the individual consumers.
Payers will be paying for all of it, but upfront costs. Wait a minute. Does that give him wiggle room, upfront cost for it? It doesn't cost you to get the test, but if you want to know what it says,
and we
that's
can
going to
currently
cost
do
you.
about 50,000 today, and we'll be able to do several 100,000 per day by the middle of May. And we're going to be working with the retailers, our colleagues that are here today, to help them as they expand their testing capabilities across the entire country. And
Will there be a COVID aisle at Rite Aid?
Mr. President, we have a rather large drug development business.
Which he nodded at.
We will continue to work with...
Can you get me the green Sudafed? It's the one with the kick. I've tried the blue and it just doesn't do it for me.
...colleagues in the pharmaceutical and the biotechnology industry to ensure we do everything we possibly can to enroll clinical trials fast.
So, hi, everybody. Yeah, welcome.
So that we can get new treatments and potential vaccines. Thank you. Thank you very much. Thank you very much.
Thanks, guys. Get out of here. Okay, next.
Mr. President, thank you, and thank the administration
Don't talk to me. Talk to the microphone.
for all of the collaboration
Don't look at me. Short people looking at me makes me short. I've heard that. It's like a curse.
to enable Thermo Fisher Scientific to be able to produce the test kits that companies like LabCorp and Quest and the public health labs around the world run. We met our original commitments of producing 5 million kits a week, and we're up to scaling that to double that in the coming weeks in terms of supporting testing around the world. I'd like to thank my 75,000 colleagues around the world for their tireless effort to make that a
They're working around the clock, mainly because they're in different time zones.
reality, and supporting all of our customers to have the testing necessary to get America back to work.
Thank you very much. Great job.
Mm-hmm. He's not a fan. Yeah.
Thank you, Mr. President. I'm John Nims with U.S. Cotton, and we are the company that is going to produce the swabs to be used in these test
Oh, that's why he mentioned U.S. Cotton.
kits.
Although, aren't nylon swabs going to be the ones that replace that? Aren't they?
We have about 1,200 people in our company, and in our Cleveland operation, they have pivoted from, as you've said, the Q-tip style swab to a swab that's going to have a plastic stick with a polyester tip. So that
Right. So, not cotton, just like I said. What do you know?
it can be
Yes, Trump is wearing lifts. That's why he leans forward.
assembled into these kits. Our Cleveland team has done a wonderful job with this, and they're very excited to be able to help in this effort. So thank you, Mr. President.
Very much. Great job.
Time to make the donuts.
Mr. President, thank you. I'm Larry Merlo with CVS Health, and it was just over a month ago that we opened up our first drive-through test site. And since that time, we have opened large-scale testing facilities across 5 states in partnership with the administration and
Large scale over 5 states. So, single big facilities in 5 states. How many is that?
working with the governor
5? Thank you, Georgina.
of Rhode Island, Massachusetts, Connecticut, Georgia, and Michigan. And these sites are enabling us to test approximately 1,000 individuals a day with real-time results.
All of those together. So all in all, those 5 different states, that's 1,000 tests a day. One dragon down, 2 men dead. Yeah, we might be getting somewhere in about 100 years. So, have your little soiree. Personally, you make me sick.
We now have a capacity to test about 35,000 individuals each week. And this afternoon, we announced plans to expand that capacity even further. Beginning in May, we will install testing capabilities in up to 1,000 CVS pharmacies. We'll be using our drive-thrus and our parking lots with swab testing. So again, you'll see that coming online.
When in May?
In May.
In May, like May 29th, somewhere around that. Thank you, Rebecca, and thank you, Corinne.
We also recognize the fact that the virus is disproportionately affecting our minority communities. So we're working in part.
No, it's disproportionately killing the minority communities. It's affecting everyone. And the testing part, it doesn't matter what color you are when you spread it. So if you test everybody in one area because they're black or Hispanic or Asian, and they could catch it again later that same day, it doesn't help. You need ubiquitous testing, unless we're just gonna. This is this push for segregation. Is that what's happening?
With organizations like the National Medical Association to bring testing and care into the traditionally underserved communities. We're also beginning to implement mobile capabilities with which to do that. And as businesses are restarting their workforce, we'll also be looking to assist them as they begin to come back to a normal operation. And finally, as my other colleagues, I just want to thank my CVS colleagues. They have done a phenomenal job in terms of helping people in many different ways.
Everybody is doing this. They will show up in a heartbeat for this picture and this piece of footage that they can use in their COVID ad campaigns.
Across communities in the country.
Thank you, Rebecca.
And they're part of this army of healthcare professionals. And
yeah, by the way, no problem with CVS or Rite Aid or any of these companies trying to help or whatever, but this parade is premature and exaggerated and all for the benefit of Trump.
Front store and,
he's the CEO of CVS.
First,
which has got to be a difficult thing to
and supervisors and workers that are doing
Trump's doing his water.
Terrific things to bring our country together, and for that we owe them a huge amount of gratitude. Thank you.
Thank you very much. Get out of the stage. Honestly, I have to say I loved him in the Dunkin' Donuts commercials. And he was terrific in everything you want to know about sex but we're afraid to ask as the man struggling with transvestism.
Thank you, Mr. President. Appreciate the invitation to be here today. And it was just 45 days ago.
Thanks, brah. Good to be here. All right.
We're here. I'm Richard Ashworth.
I'm Richard Ashworth, head of the Hip Nerds of America.
Oversee Walgreens in the U.S. And I just want to start off, Larry.
I oversee Walgreens in the U.S.
You thinking the over two.
Yeah, it might be a good idea for CVS and Walgreens to stop selling cigarettes, considering it's a lung disease.
100,000 Walgreens team members who are in stores every day all across America taking care of our patients and our
Thank you, Georgina.
Customers, giving them essential daily needs, the prescriptions, obviously, that they need, and even COVID testing while we're here. We also announced today we'll be expanding our testing capabilities across all states, including Puerto Rico.
You're not going to contract your testing capabilities? I thought for sure you guys... CVS stopped a while ago? That's good news. I wouldn't know because I don't smoke, so I don't look for them. That's great. Okay, good. Mr. Rite Aid will be up in just a moment. I think it's... I think it's a woman, actually. I think the head of the Rite Aid CEO is a woman, if I'm not mistaken.
We'll be able to triple the volume that we do now in partnership with our lab partners, and we're excited to be able to do that. We're really excited with the public-private partnership that we have here because that's what enabling us to do this. And
why wouldn't we? I don't understand why they think this is such a surprise. You know what I mean? Why? Does anyone suspect that we wouldn't engage private laboratories and... No, they're not saying anything new today.
Forward to working with the additional states to get these sites.
Remember what we were doing yesterday? We're doing a little more than that. That's the whole point of today.
Up and running as fast.
P.S. Don't forget that I said drink, inject bleach into people's lungs.
As possible. As a pharmacist, I just want to say one quick thing. I'm really proud to be part of this profession, and not just Walgreens.
Oh, thank God. I thought he was going to have that conversation about condoms with us.
Pharmacists and pharmacy employees, but
thank you,
all of them across grocery, mass, independence. You're really doing what you should be doing and what you went to school for, to help patients, counseling them on their medicines and helping them understand the problems that we're facing. Pharmacy is right here in it with everyone together in the community. And we look forward to being part of the testing like we are now, serology, whatever that might look like in the future, and eventually...
You mean going there and getting a blood test at the actual facilities, which will be a newly added thing to probably Walgreens, CVS, and Rite Aid going forward?
When the vaccine does come. So thank you, Mr. President, for the opportunity. Thank you.
What do you think the potentiality for the diabetes checking, like for people to check their blood sugar levels, modernizing those? Look at that. Splash. Thank you for that espresso strike. Glass is getting out. The tip jar is getting out of control. I don't know what's going on there, but I love it. Yeah. This guy deserves a Nobel Prize, though.
Thank you, Mr. President. Thank you, Mr. Vice President. We appreciate all you're doing to get America back to work and doing it safely.
As the CEO of Televangelist Lookalikes and Anonymous.
Represent Kroger, and my name is Rodney McMullen. And
hey, Rodney, my mom shops at your stores.
I am so proud of our nearly 500,000 associates that are doing everything every day to keep customers.
I know he meant to say not only, but it sounded like nutterly.
Safe and our associates safe. And one of the things that we were able to do is provide the basic practices we're doing. We call it Blueprint. And it's the things that all of us can learn from.
Really? That's a brand new word. I'm not familiar with it. You mean to plan out something?
On how to get America back working. We also announced earlier today, continuing to accelerate our practice on testing. We are actively engaged in.
Do we know if he just walks off after this, by the way?
States. In the next couple of weeks, we'll take that to 12 states. And the number of tests that we do continues to grow faster than that. Together, we will win. Together, we will solve this problem and move on.
Hey, don't steal my lines, buddy. I get to say win.
America is always great. Thank you again.
Oh, look at that. He was going straight up. Hear that? I threw in a little, he's looking over his shoulder at Trump as he leaves. I threw in your slogan. I hope you like it. Get it? Great again? And let's see the hearts coming out of Trump's head for that. He loved it. Did that for you, buddy.
Thank you, Mr. President. My name is Doug McMillan. I'm a Walmart
I'm not going to touch anything.
associate, and I, too, would like to
Oh, maybe I am.
start by thanking our associates for everything that they're doing in our stores, Sam's Clubs, distribution centers, and in our e-commerce fulfillment centers. They've been inspiring and continue to have a can-do attitude and step up. It's much appreciated. We started 45 days ago, as did everyone else, and we've been operating sites for a while now. We're now up to 20 sites across 11 states. By the end of next week, we'll be to 45, and by the end of May, we'll be at 100. We also, a few weeks ago, Vice President Pence
Across the same 10 states?
and I were in a distribution center in Virginia, a food distribution center. He was kind enough to come and thank our associates for us there, which is much appreciated. And the president and vice president were speaking on the phone about surgical gowns, and the president asked if we could put in an order for millions of surgical gowns, and we don't normally buy those, so I wasn't sure if we were going to be able to do that. But I'd like to thank our apparel team and McKesson in particular for partnering with us. We've been able to, in the month of April, secure an additional 2.5 million surgical gowns. And by the end of May, we'll have an additional 6 million available to help. So thank you for the opportunity to serve and for being here.
Great job. Thank you.
Good job. Thank you so much. Oh, there is Q&A? Oh, I'm excited.
Thank you, Mr. President, and thanks to the team for getting this great operation up and running for the benefit of the country. I'm Hayward
Hayward
Donegan with Rite Aid.
Hayward Donegan. She's with the Southern Florida Timeshare Realtors Association and pharmacies.
And we are currently operating 40% of the current test sites in 25 locations across 8 states.
So cha-ching!
And I had the opportunity as I was driving up to stop at our Richmond location.
Thank you, Josephine, for the rainbow.
And see the testing in action and thank the associates, whether it be security or pharmacy, front end, everybody who's helping with this great effort, and all of the customers that appreciate this so much. It was really...
By the way, big fan of Rite Aid, very useful when I'm on the road. Cool. The only woman CEO with us today. Cool.
Amazing to see. And I want to thank my 50,000 associates also for keeping these retail locations up and running during these really, really tough times. It's been quite amazing. And we, too, are going to expand our testing, and we're doing about 1,500.
You're not going to contract? That seems so weird to me.
A day. Thanks.
Yeah, that's around 3 test sites per state that they're talking about. But that also assumes that it breaks out into the other states, which it does not.
Thank you all very much. It's incredible what we've done together over a short period of time. I want to thank our Vice President for the task force and the work.
Did everybody's test come back negative, Mr. Fondle the microphone?
Every day.
Yeah, she's fine. Like, again, I don't have I mean, obviously the Kroger dude is a big booster of the president, but everybody else is, you know, whatever. They're CEOs. If I was a CEO of a company, I'd be up there as well. We didn't see Sahafa ho.
It's better, and we
Whoever
had a
they are.
fantastic call with the governors today, and I would say that they are as thrilled as they can be, considering that the
Thrilled as they can be. I can't. It's the president is on the line. He's here. I can barely contain myself.
fact is that there has been so much unnecessary death in this country.
How much necessary death happens every year? From disease, anyways. Let's just keep it within the ballpark. I mean, you know, it's necessary that a certain number of people
Could have been stopped, and it could have been stopped short.
And yeah, according to Fauci, if you'd have just started mitigation a week earlier, 90% of it, right?
But somebody a long time ago, it seems, decided not to do it that way.
You mean in November when you told the Israelis that to expect a pandemic? Like that kind of long time ago? Or February when you were golfing? Or March when you had a rally? Like that long ago? I mean, everything seems a long time ago. We've been living for 56 days like this.
And the whole world is suffering because of it. 184 countries at least.
At least you haven't updated your numbers since you suggested blasting people with giant radioactive tanning beds.
I want to thank all of these great business men and women for the job they've done. They've been fantastic.
Men and women, but I appreciate where you're coming from.
Fantastic with us, working with us. And as you know, for
lady and gentlemen,
for weeks, my administration has encouraged the governors to leverage unused testing capacity in states. Very few understood that we have tremendous capacity.
Yeah, really? No, they know they have those facilities. They just don't have the right to take over private industry. And you can do it through the DPA, but only if you do. So pointing to a lab and saying, make them do it, they legally have no right to do that. The capacity thing is just BS. That's just him lying, blaming the states for not acting. Like, they have all this stuff. Why don't they use it? Because they don't.
Then 1 week ago, we provided each governor with a list of names, addresses.
A list of names and addresses.
And phone numbers of the labs where they could
call them. Stop calling me. Call the, you know, that stupid company you got doing rape kits? Have them close it down. I mean, none of those people are guilty anyways. Leave people alone.
Find additional testing capacity in their states. Within
Jeffrey Epstein didn't kill himself.
48 hours, the number of tests performed across the country began to absolutely skyrocket.
Did it really skyrocket? Really? 1% of the population? That's skyrocketing? How'd your rocket test go? It got 1% off the landing pad before it blew up.
On Saturday alone, more than 200,000 tests.
If you tested a rocket that got 1% of its trajectory right,
results were reported, which is a gigantic number, bigger than any country anywhere in the world for.
Not per capita. Do I have to remind everyone? Ding! Bonk.
You using the whole fist, Doc?
Much longer period of time. A number that is an increase earlier in the month when we tested roughly less than 100,000 a day.
Yeah, you don't get credit. That's like saying, before I was in the boat, I did very little rowing in the car. Why are we supposed to be impressed with how little you did in the beginning and how behind you are compared to where you said you were going to be, because you're doing a lot more than when you were doing fuck all?
So we much more than doubled it, and that will be doubling again very shortly.
No, it won't.
We are continuing to rapidly expand our capacity and
by the way, doubling is way easier to do when you're not doing shit. Yeah, his hair does have a. I think they super sprayed it today, Kath. You well spotted. They super sprayed his hair because it's windy outside. So I think it's basically a piece of concrete right now.
Confident that we have enough testing to begin reopening and the reopening process. We want to get our country open.
We want to get our country open and back.
And
Open.
the testing is not going to be a problem at all. In fact,
yeah, it is going to be a problem. We don't have enough. We're nowhere near the capacity we would need.
It's going to be one of the great assets.
Yeah, 0 times 2 is still 0. Yeah,
that we have today. We're releasing.
Yesterday we had 2 tests, and today we have 4 tests. We doubled our testing capacity. And tomorrow we're going to have 8 tests. We've doubled our testing capacity. And notice the doubling capacity starts to go down, which is why the testing number started to go down, was because they were looking at, that was the exponential curve. It was starting to peter out.
Additional guidance on testing to inform the states as they develop their plans for a phased and very safe reopening.
Like Georgia?
Our blueprint describes.
You can get a massage from 6 feet away.
How states should unlock their full
Thank you, Lucid Fury.
capacity, expand the number of testing platforms, establish monitoring systems to detect local out.
Seriously, I don't know what's on the lens. Are they just washed out? Have they not color corrected? Or is there a fire? Why? Look how gray this is. What is happening? Christine F., thank you so much for the super chat sticker. Shiba Dog laughing slightly while blushing and covering his
breaks and conduct contact tracing. We have it all.
No, we don't. Just saying we have something doesn't mean I have a Cadillac on the roof of my house. I said it. It must be true.
Other countries are calling to find out what are we doing and how do
we have noticed that your citizens are dying at a much higher rate, and we want to know what you are doing so we can not do the same thing.
You do it, and we're helping them. We're dealing with a lot of countries helping them on testing.
Yeah?
Just like we did on...
Can you... is there any way, Donald, that you could help us fill out our don't column?
The ventilators. I directed our Medicare program to make it easier for seniors to get the testing that they need, and the pharmacies, as you know, we are allowing pharmacies now to do testing.
Yeah, oh, really?
And we have other testing locations that we're going to be allowing also.
Well, like Walmart parking lots, right? There were drive-through Walmart parking lots. They're everywhere. Yeah. Honestly.
But having
Hi, Lucifer.
Pharmacies get involved in testing is a very big deal. We're also asking governors to do the same in their Medicaid program, so they're going to be able and authorized to do the same in Medicaid. So that's a big deal. So we're deploying.
Look, letting someone do something they can't do yet is not impressive. You know what I mean? Like, that's super weird. We're letting them do something they don't have the capacity to do at all. It's super odd.
The full power and strength of the federal government to help states, cities, to help local government get this horrible plague over with and over with fast. There's tremendous energy in our country right now. There's energy like people haven't seen in a long time.
I've got plenty of energy. Thank you very much. I've been working out from home. How are you doing? I couldn't believe how much energy I have. Oh, I had so much energy it shut my camera off. That's right. Too exciting. Standard background blur. Creative audio. What's wrong with you, camera? Wake up. There we go. Now we're back. Come on. I like the moment where I'm slightly blue in the camera for a second. I do enjoy that. You know what I mean?
A spirit that they have not seen, and
spirit. Yes, it did, sir. No, spirit, bravado, a touch of doing do. About 11:30.
We're doing very well, very well.
Well, we're doing. I will give him this. We are all doing better than if we'd been blasted with UVC light and had Lysol injected into our lungs. So on a scale...
Considering what happened to us and considering if you look at what happened to others...
yeah, you mean us having more deaths?
This is something that the world has not seen for a long, long time. You can probably go back to 1917,
Oh my God, 1918.
where it was a terrible period of time.
Was it really? What was it? The music? Or you just don't like the fashions? What was it in 1917? Because obviously, I mean, the Spanish flu happened the next year. So, I mean, God, 1917 must have been awful to have you bring it up, you know, as worse than the Spanish flu. Man, what was that? It's not gray on TV? All right, well, then it's this. It's the feed I'm getting.
Know what happened in 1917. That's over 100 years ago. With that,
Is it? I'm citation needed. That's over 100 years ago. In case you didn't know, it's 2020, and therefore,
I'd like to introduce, if I might, Dr. Birx, if you could come up and
oh no, and tell everybody how I was right about injecting Rain-X window washing fluid into people's lungs.
Admiral, you'll come up and
They only had 100 channels in 1917. There was no Netflix. I don't know how people would have done it.
between the two of you, you'll explain the entire process and how much progress we've made and where we're going. Thank you very much.
Oh, she's wearing space karate today. Dun, 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 dun. Space karate.
Mr. President, so the blueprint lays out the roles and responsibilities.
Excuse me. We have guidelines. Kroger has a blueprint. Try and keep up. Unless blueprint is the next scarf you're going to be wearing.
Enhance our
I'm wearing the blueprint today.
partnership between the private sector and the public sector, bringing together state and local governments
I'm not actually here. I'm a hologram from Elysium.
with the federal government to ensure that we can accomplish and achieve our core principles and objectives. We can have the first slide.
Oh, she's calling her slides out again. Hold the clicker. This is like the most this is like the most annoying TED Talk in history. This is like somebody like my TED Talk today is on how you should never be afraid to delegate. Slide, please.
Core elements of the testing plan include both three elements: robust diagnostic testing plans developed in partnerships with state, and I just really want to thank the governors and the health officials, both at the state and local levels, who've been working.
Wait a minute. You're rolling out a plan? This is ridiculous. They're rolling out a plan and a new name for the plan. And
with us day and night to work through these issues, and also all the laboratory directors in many of the states, as well as the American Society.
Yeah, right. Next slide, please. I said next slide. Slide number 3.
For microbiology, who've been working with us to ensure that the plans were efficient and effective. Within the robust diagnostic testing plan,
she kind of reminds me of the woman of was it Kate? Who was the woman who's in charge of the front of the train in the snow was it Snowplower movie or whatever it was?
It was really
blitzing on it. Never mind.
Unlocking the full capacity of the state, increasing the number of testing platforms. We now have multiple tests for.
Yeah, they should be showing slides. I don't know why.
Different platforms.
I mean, it doesn't matter. This is just dumb.
Increasing the ability to collect samples, increasing testing and laboratory supply.
Thank God we have geniuses in charge. I would have never thought of this. Snowpiercer, thanks very much. Yeah, she looks like the woman who heads up the front of the train. Yeah, Tilda Swinton, Snowpiercer, just like ragged. We're holding on to some semblance of our society up here in the good train.
And ensuring that we work together to make sure that every client receives the tests that they need.
Yeah, she's got Judge Janine hair today.
This is added with timely monitoring systems. And what do I mean by that?
You mean monitoring systems that are timely, that are focused largely on the outbreak areas because you have limited resources and you don't have enough tests. You have to go to the areas where you figure they will do the most good, that kind of thing?
Where we bring together the ability to not only diagnose the symptomatic, but proactively and interactively work with individuals that we know are at higher risk. We've worked with states to look at where the outbreaks have occurred when they're not in the large metros, and we see that it occurs very often in places of closed settings among our Native Americans and among our long-term care facilities. So
what Navy boats as well. Hey, didn't that guy get his job back just recently? I can't stop lying. How are you? Happy Monday, brother.
Monitoring program that's active, integrated, and innovative. And then combining us with the third element, which is the rapid response program.
When's that going to start? Rapid response. Exposed to this drag-ass response that we've been doing for weeks? This is a whole new setup.
Relying on CDC to be working with state and local governments to ensure that every symptomatic case, and critically the asymptomatic cases, are quickly tracked and traced.
How can you quickly track and trace asymptomatic cases unless you have massive, broad-based testing? That's, yeah.
Ensure that we can not only control this epidemic, but predict outbreaks before they expand. And then finally, the plan includes...
You mean, oh, you know what would be a good idea? A pandemic response team where they keep track of, like, outbreaks in other countries that might reach a, what am I, nuts?
It's approach of using science and technology to develop...
Let's party!
Even newer platforms, more efficient testing, really ensuring that the antibody tests that are utilized and recommended.
Why do you need to be more efficient with your testing if everyone who wants a test can get a test?
Both FDA and CDC.
I mean, if I want a test, I should be able to get a test. Psst. Right?
Have high quality in predicting both exposure to the virus and antibody development. And then finally, working on innovative tests that could be high throughput and point of care, an antigen-based test, or a point of care expanded nucleic acid test. Thank you.
And she's bugging out. Like, this is just the same stupid thing. She's going straight Bigfoot on her exit right there. Like, just blur me and let me leave. So, rapid response, I like how that sounds. So we're just going to call everything we've done so far rapid response. Nope.
Thank you, Mr.
Don't use loose paper. It's windy.
President. Thank you, Ambassador Birx. If I could have the next slide, please.
Oh, great. It's catching.
Want to spend just a couple minutes about going over where we've been, but more importantly, where we're...
Oh, thank God. Guys... Those of you that don't know, I mean, you've been doing a lot of other stuff, so you probably aren't aware that we've been sequestered for like 50 some odd days. I don't know, maybe you're just joining us. Hi, if you've just woken up from a coma like Cillian Murphy and 28 days later, about 7 months ago, the CDC and the intelligence community and Chinese authorities were starting to realize and warn about oh, you'll catch up. Never mind.
I think we all can understand how we can group this into 3 distinct phases.
Oh yes, I can definitely. Let's do it. 3 distinct phases. Here we go.
First is our launch phase, when we were really in.
Yes, we launched this disease into the public, and we were using like crop dusting it on people. We launched. Oh, our response. Okay.
Aging, the emerging epidemic, and the types of things we need to do. For example, mobilize the private sector to develop, test, and have EUAs.
Do you really have to do that? Or are they going to do that on their own because they know that there's a huge market and those companies do that for a living? Anytime a disease happens, every single pharmaceutical company has like a jump team responding to getting the treatment or the vaccine out faster than anybody else because their entire bottom line is based on that. Why would you have to go, guys, I don't know if you didn't think about this, but I was just spitballing. But back in 1917, if somebody had thought about a Spanish flu vaccine.
Over the past 2 months, the FDA has issued 67 emergency use authorizations, which is far outpacing anything.
Yeah, that's not mobilizing the private sector. That's removing barriers to the private sector, which is what every single administration does in these circumstances, even on a smaller scale.
That has been done or could ever been imagined.
No, I can imagine a lot. Don't ever limit my imagination.
The research community.
I can imagine, what if this turns out smoking catnip is actually the cure? Purebred tabby. You know what I'm saying?
In the commercial labs.
I can imagine that. It's not true, but I can imagine it.
The reason why we're here with ACLA Labs having done about 3 million tests is because of that day when it was galvanized by the president and the vice president.
Mm-hmm.
We also set models in the community. Those first community-based testing sites that were federally supported and really under the direction of the...
Federally supported? How? What'd you do? Did you let the National Guards put some tents up? Did you pay for the cones? You didn't buy the swabs unless you stole them.
U.S. Public Health Service, people who had been in Japan testing people on the Diamond Princess to assure that it would be done right and it would be done safely for everyone involved.
Let me guess. Coronavirus, long stem swab up in the nose, scraping up in the sinuses up here to get a full thing, pulling it out, trying not to get coughed on in the process, put that in a tube, seal it up, put that in an envelope, write on the envelope who this test subject was, where they were tested, the date, I'm guessing, a lot number, so you can track entire boxes of them for tracing as far as data. Something like that? I mean, what the hell do I know?
Then we moved to really scaling. That phase was...
Did we really move to scaling?
Very, very important, because we knew we needed to be at an immense scale to enter.
And we knew we need to be in an immense scale, and we are.
The third phase about supporting opening again. This again, for example, a lot of my life is about swabs.
That's too much information. None of us need to know that. Is that a bragging point? A lot of my life is about swabs. I do not want to see his collector's bookshelf. Whatever. Every time I clean my ears, it's a whole new display.
It was enhancing the production capability of a small company in Maine called Puritan that you'll hear a whole lot more about, that is sort of the swab provider for the country. But
really? U.S. cotton was full of shit then, what you're saying?
Also because of the FDA actions and the actions of scientific community being able to broaden the types to spun polyester. So U.S. cotton can now come in and start delivering within the next couple of weeks.
That's not unique to the world. They use spun polyester in a bunch of countries for this. Polyester it's the same material as the plastic envelope or the tube you put the stuff in.
3 million swabs per week.
Cotton has a DNA profile. Plastic does not.
Of a different type. It also did things like expanding the community-based testing sites. Whereas we started small with the commercial partners, you see today, right now, we have 73 of this 2.0 sites going to 110. And very importantly, this demonstrated the model.
73 going to 110. Let's see, 50 states, 350 million people. Okay.
And 68% of those sites are in communities of moderate or high social vulnerability, and 22% are in the highest social vulnerability communities, so that we can make sure
22% of what, 110?
The testing gets where it needs to be. You've just heard that could be expanded to thousands of sites.
Well, it could be, but will it? No!
Finally, stage 3, which is very exciting, coordinating with governors.
That's right. My life has been about swabs. I try to style my head after one.
Support testing plans and rapid response programs. Over the past week, a multidisciplinary team from the White House, HHS, FDA, FEMA, has met virtually with multidisciplinary teams from every state, Puerto Rico and the District of Columbia, to understand what their testing aspirations are and to make sure.
Let me guess, ballpark, what do you think their testing aspirations are, guys? I'm just gonna, anybody got a general idea? No? Yeah, like, what, let's see, test, a lot more than they are now?
Or that we can meet those demands. We're gonna have another round.
You mean like Dr. Burt's demanding another slide?
Those calls this week, but as we talked about earlier today, we will be able to supply every state with the supplies and the tests that they need that will dramatically increase the number of tests we've done to this point. And just to give you an idea.
That's not even close to true. That's why you're telling them to open up the labs in their individual states and use those. If you're going to supply them with the swabs, and thank you, Amy K. Yeah, we passed 12,000. Look at us. Hurrah! Don't forget to share the show, everybody. Pass it around. Let everybody know we're here. Let them know you're there.
The supplies that we will be providing to states, the minimum that we're supplying to states is approximately double in that month than the Republic of Korea has performed in the 4 months to now accumulate.
Yeah, but they have a lot fewer people, dummy.
To give you an idea of the amount of testing that we're going to be.
I have an idea of how many people they're testing. And the reason why their number is lower is because they bent their curve earlier. They don't have to test as much because their track and trace is in place. See? So they only have to test people that have been in contact because they've got a handle on, yeah, never mind.
Going to be doing. So I'm very exciting right now.
You are very exciting. I think he's exciting. Guys, he's super exciting. He's very exciting. I'm excited. Are you excited? You mean you're very excited, sir? Is that what you meant?
We complete this ecosystem with the large reference labs. LabCorp and Quest providing the very high throughput, large-scale testing, the galvanizing of the hospitals and academic labs that Dr. Birx has done by a machine-to-machine understanding and promoting that.
Yeah, thrilled to death. No kidding, Hal Beckery.
With the governors. And, of course, using point-of-care testing when and where that's very important to stop outbreaks or in remote areas like in the Indian Health Service or in Alaska.
Or in South Dakota at a meatpacking plant.
Thank you, Mr. President.
Okay, so with that, we're here to answer some questions. And Mike is up here also, so we'll answer Steve.
Oh, good. Mike's, yeah, here you go.
Please, go ahead.
Grapple with when and how to open their states. What's the best advice from you on what they should do?
Thanks, William. Welcome.
Well, we want them to do it. We recommend that they do it as quickly as possible, but safely. We want everyone to be safe. And I think...
Do you? Really?
You're seeing that. You're seeing a lot of governors get out and they want to open it up. Many are thinking about their school system. Not a long way to go in the school system right now for this season, for this year. But
the season of school? Yeah. Yeah. What's the big finale at school every year that they do? Yeah.
I think you'll see a lot of school.
Congratulations. I'm going to West Point as part of their season finale.
Open up, even if it's for a very short period of time. I think it would be a good thing because...
Open up schools for a very short period of time? For what?
You see, in terms of what this vicious virus goes after, young people seem to do very well. Young people seem to do very well. So I know that there are some...
They don't do very well. They just don't get sick from it. But they transmit it. Jesus Christ.
Governors that aren't necessarily ready to open up their states, but they may be ready to open up their school systems. We'll see. But that's their choice. But the word is safety. Okay? Rapid, but safety. Yeah, please.
Rapid, but safety. Thank you. Rapid, but safety. That's, you know.
Go ahead, please.
Thank you, Mr. President. I have a question for you regarding one of the members of your coronavirus task force, and that's Secretary of HHS Alex Azar.
Yeah.
January the 28th, he was in the briefing room, and in the briefing room, he told reporters that for the individual American, the virus should not be an impact on their day-to-day life. 3 months later, more than 55,000 of our fellow Americans have now lost their lives. Mr. President, why is he still your top?
Why haven't you fired Alex Azar yet? The guy who was,
advisor, why is he still serving as the HHS secretary?
Well, I think it's a very unfair question because you have...
Because all he said was something that's the biggest, caused the biggest shutdown in the entire history of the country. All he said was it was no big deal. Right as it was becoming a big deal. I don't know. That seems unfair.
Many great professionals, some of them you have great respect for, and you have many people in the other party. You mentioned Alex Azar, but you have many people in the other party that have said the same thing and with even more confidence.
Yeah, he was he's running the Health and Human Services. He's HHS secretary. So he's the one that actually matters in that discussion. People not having the same amount of information as him, making a more open statement about the country. Yeah, those people are less to blame than somebody who has literally been a part of the task force since January and has been aware of this pandemic threat since at least late November.
A lot of people didn't get that right.
Yeah,
I was very...
It's his job to get that right. It's not their job to get that right. They don't have the full information. If they had more honest information from him, they might have spoken differently.
Fortunate, whether it was through luck or whatever, that we closed the border. We put a ban on China other than our...
Than 40,000 people? Other than what?
Citizens coming in. We had our...
Other than 40,000 people coming in, we put a ban on China. So since only Chinese people who aren't citizens can get this disease, I guess we're cool, right? This has all been a hoax.
Citizens, you can't keep out American citizens. You know, gee, you can't come back into your country. That's a little tough to do, but we put a ban on China. That was very...
No, you didn't.
Fortunate, but I could tell you that Nancy Pelosi was dancing in the streets in Chinatown. She wanted to go...
Was she dancing in the streets in Chinatown? Do we have footage? Anybody got footage of Nancy Pelosi? Oh, I know. He's mixing it up with those people who are dancing in the streets in New Jersey about the Twin Towers coming down. He mixed it. I mean, they looked like Nancy Pelosi anyways.
Let's go out and party. Now that was...
Let's party!
It's late into February, so you don't mention that, but you could mention that.
Late into February. Was she?
Go ahead. Any other? Please go.
What? Any other opportunities for me to launch a turd bomb full of lies? Anybody?
Go ahead.
Mr. President, he has not been in a briefing.
Yeah, please stand up.
Since April the 3rd. Does that show confidence?
You should have no complaints, please.
You should have no complaints. You should have 56,000 Americans dead so far. You should have no complaints. Millions of dollars going to corporations with more than 500 employees repeatedly, and them getting caught and having to pay it back. You should have no complaints. The SBA loan system being overrun and losing all its money. Most of the companies who had who got the loans in the first round had massive holdings. Very few people who actually needed it got it. You should have no complaints. No, don't complain. I mean, you should have no complaints about my Chinese tie and where my pin was made.
Today, you retweeted someone who alleged that Democrats have quote, inflated the mortality rate of the coronavirus by underreporting the infection rate. Do you believe that's true, that there's some sort of conspiracy theory regarding the number of infections states are reporting?
Well, I can only say what we're doing. We're reporting very accurately. If you look at other countries are not. I mean, you can look at China. You can look at numerous countries where
Which numerous countries? What do you mean, Russia? Yeah, I'm not going to buy their numbers. Why don't you say Russia? Say Russia. Say Russia. They're digging mass grave sites, but they only have like 45 deaths. That seems a bit of an overreach.
I don't think those are right numbers. I can only say what we're doing. It's very important to us to do very
you're going to only say what we're doing? Well, apparently not.
Accurate reporting, and that's what we're doing. John, go ahead, please.
By retweeting that, Mr. President.
Thank you. Please.
Mr. President, I wanted to ask you about the payment protection plan, the CPT plan to help small businesses.
Yeah.
There have been a lot of concerns today with the website just not working. In fact, we heard from the American Bankers Association saying that they are deeply frustrated, and until it's fixed, American banks will not be able to help struggling small businesses. Do you know?
Well, I just came out and I hadn't heard.
Look, that whole system was made by the Obama administration. I don't. That's true. Can't stop lying. They were very big hipped people in that. Yeah, so
I heard there was a glitch. We'll find out whether or not that's so. Certainly, it did work.
What do you mean? Find out if it was so? It is so. It's true. If you don't know whether there's a glitch or not, you're not in charge of it. This whole, like, his constant answer with this nonsense where he's like, we'll find if that's, I haven't heard that, but I'll find out if it's true. When he's supposedly working around the clock about this problem and he's in constant meetings, and yet he never knows the answer to any of these questions when they're brought up.
Out very well for the original amount of money. This is the second amount, and I'll find out about that. We'll find. We're relying on the banks to go out and do an accurate job. Yeah, please.
Oh yeah, you're relying on the banks like like it's the governor's fault. Nothing is this man's fault. Jesus.
In the back.
All the companies that get aid, Mr. President.
Well, I wouldn't mind doing that. I don't know what the legal status of something like that. I would like to do that, as far as I'm concerned. I'm not involved in that process, but I would certainly like to have it listed. I'd have to find out if there's a legal problem, but if there isn't, I would do it gladly. Please.
Thank you, Mr. President. Charlie Spearing from Breitbart News. And a majority of polls show that Americans blame China for the spread of the coronavirus, and yet they're taking advantage of the crisis to make the world more
Geez, Breitbart comes up with their own poll.
dependent on their supply chains. How do you hold China accountable, and how do you keep our country?
Well, Charlie, there are a lot of ways you can hold them accountable. We're doing very serious investigations, as you probably know, and we are not happy with China. We are not happy.
Well, that's good. That should solve it. He's not happy
with that whole situation because we believe it could have been stopped at the source. It could have been.
Yeah. That's weird. Should we go back over all your statements about? Thank you, Kurt. Appreciate it.
Stopped quickly, and it wouldn't have spread all over the world. And we think that should have happened. So we'll let you know at the appropriate time. But we are doing serious investigations.
Right after my taxes come out and the Republican health care plan in a very short period of time, we'll let you know.
American businesses from relying on China for their supply chains. How do you fix that?
Well, we've already discussed that, and especially having to do with medical supplies and others. If you look prior to this virus, the deficit was coming way down under my administration.
Oh no! Oh, not even close. Thank you. Yeah, no, your deficit is double what it was under the last year of the Obama administration, and it's going up.
Because I put massive tariffs on China.
That has nothing to do with the deficit.
We took in tens of billions of...
Does this asshole think that the deficit is our trade imbalances?
Dollars, gave some of it to the farmers who were unfairly targeted by China. Nobody's ever done that before. We never took in 10 cents from China. Now all of it...
Oh, God. They buy more of our stuff now than they did before because all their pigs died.
Sudden, I think you know very well,
they were going to buy $50 billion worth of pork products, period.
In tens of billions of dollars. I helped the farmers by giving them 2 years ago $12 billion, all coming from China. And we had plenty left over, too. And then the following year...
No, that's not where that money came from.
$16 billion. And this year, we're also going to help our farmers. But nobody's ever done a thing like that.
Yeah. So we're paying... China's going to buy $50 billion worth of agricultural goods from the United States. And so far, the American taxpayer has paid the farmers in the country $68 billion to make that stuff, or give it. I don't understand. We're losing $18 billion on the deal
because they were targeted unfairly by China. So
no, they were targeted fairly. That's what a tariff war is.
Doing a very strong investigation, and we'll let you know what the result of that is.
Sure, in a very short period of time.
We should be able to get the answers to.
President.
Go ahead, please.
Yeah, farmers don't want bailouts. They want to be able to sell their goods, and there's nothing wrong with that. You started a trade war. They were on the receiving end of it because that's the majority of the stuff that China buys from us.
You talk about potentially reopening.
What do you think they buy plastic toys made here? Really?
Up America,
Really?
which we see in the slides behind you. What data are you going to look at in the future to see if restrictions
That's hilarious.
need to be reimposed?
Yeah, we're looking very much and reliant very much on the local areas, the governors. And that's been the way it has been for me. Maybe not for everybody, but for me, that's the way it's been at the beginning and from the beginning.
Yeah, you've always shoveled your work off onto other people, you mean?
The governors, some of them are doing an extraordinary job. Not all of them, but some of them. And I think all of them maybe has it.
Sure, really? I mean, an extraordinary job by your standard of what an extraordinary job is? Or Jesus Christ.
Some will be a little bit different. The areas are much different. Manhattan is much different than Montana. You have a lot of different circumstances, but and obviously,
Yeah, define those circumstances. What, big swaths of land, everybody's separated? That's what you're going with? It's actually easier to sequester and not get your own groceries when you live in Manhattan than it is when you live in Montana. And one person spreading it through Montana can have an outsized effect on that entire state. But go ahead.
if you look at the virus, it hit some areas, hasn't hit very much other areas, not even at all, almost at...
Yeah. Because how much testing are you doing in those states?
Not at all. But the entire country
That's true.
has been infected. West Virginia is an example. I spoke to Jim Justice, the governor of West Virginia, and they were long before anything hit, and they had numerous deaths, even in West Virginia, and they were really the last one to be hit. So we're dealing with the governors. We had a really great call today, as I told you. Very, very solid. These were not complaining people. These were people that they had everything.
These were Republicans.
They had their ventilators. They have their tests.
These were ass kissers of the highest order.
Moon River. They see their testing is growing. They're growing their testing. We're helping them. We're getting them what they need.
No, you're telling them where their labs are that they should use for other stuff.
And that was a group I'm sure some of you are on the line, even though you weren't supposed to be.
What does that mean? He does that all the time. He thinks he's being spied on by the press during these I think these governor, calls that he has, that he thinks that those governors are having the press on their side as to what? Record and witness what happened in the calls? So thank you so much, Stephen.
And I think you know what the result of that call was. Please go ahead.
Do we? I don't think we do, actually.
Sir?
Let me guess, though. It was a 10?
Question on making China, holding them responsible. Germany sent a bill to China for $130 billion, 130 billion euros for the damages caused by the coronavirus. Would your administration look at doing the same?
Well, we could do something much easier than that. We have ways of doing things a lot easier than that. But
we have ways of doing things that are much easier than that. Now, what shall we talk about?
Germany's looking at things, and we're looking at things, and we're talking about a lot more money than Germany's talking about. Yeah, please.
Then you're not.
Go ahead. We haven't determined the final amount yet.
We haven't determined. He's making it up. We don't have that. That's not happening.
It's very substantial. If you look at the world, this is worldwide damage.
Right. So we're going to put China out of business now? Is that what the goal is? The entire world's going to try and bankrupt China? How are you going to manage that? Are you going to be on the side of China in this exchange, or are you going to be on the side of Europe and the rest of the world? Interesting choice. Russia shares a border with China. They shut it down before you did.
This is damage to the U.S., but this is damage to the world.
Right. So we're not trying to punish China for us. We're trying to punish China for the world. Is that what we're saying? Is that your idea?
Please.
Yeah, please. Please, OAN, anybody, please.
Attorney General William Barr directed federal prosecutors to watch out for state and local officials that might be violating the Constitution by some of their stay-at-home orders. What's the strategy there? Will the federal government sue local authorities?
Well, you'd have to ask Attorney General Barr, but I think he wants to see, like everybody, he wants to see people get back and wants to see people get back to work. He doesn't want people to be...
What the hell? But that's not his job.
...held up when there's no reason for doing it. In some cases...
The reason would be asymptomatic spread of a contagion that kills at a level of 20 to 30% higher than the flu does, and the flu kills 70,000 people a year in the States.
Perhaps it's too strict. He wants to make sure people have their rights and they maintain...
That's what he's worried about.
Rights, very importantly. So a lot of people would agree with him, but you'd actually...
So he's trying to abort the orders of the governor, to use language that might work for him.
You have to ask that question specifically from a legal standpoint to Attorney General Barr.
Government suing.
Did you direct him to do that? That's the follow-up.
It would depend on the state. It would depend.
If it's a red state, if I need it for re-election.
On the circumstances of the state. Some states are, perhaps a little early, and some states are a little bit late. And the Attorney General, I read that and I saw that, and frankly,
Yeah, no, he didn't.
the Attorney General doesn't.
I love when he pretends to have read stuff. And like, I've been thinking about that a lot lately. We talked about that. I've talked about it a lot, but we haven't made a determination yet.
Want to have rights taken away because, you know, there are some people, they're not allowed to open up a store, or they're going to lose their livelihood. And by the way,
As opposed to their lives, because life is a part of livelihood. I've made just enough food to shovel into my corpse.
hey, that causes death also, between all of the things that happen. And this has been a big.
Well, you mitigate that through the support that the federal and state governments give so that people don't feel like they're behind that. You make sure that's your responsibility. If people kill themselves, which is what he's talking about here, because their business has been ruined and their livelihood is gone, that's a failure of the federal and local government to get the aid from the federal aid to them. That's not just because some people get sad and that's tough shit.
Study, you know, the fact that people aren't allowed to have their freedom causes a tremendous amount of problems, including death. So that
people aren't allowed to have their freedoms. I guess freedom to die.
That's what he's talking about. Please, in the back.
This is the jackass presidency.
Maryland and other states, Governor Larry Hogan specifically said they've seen a spike in people using disinfectant after your comments last week. I know you said they were sarcastic.
I can't imagine why. I can't imagine why. Yeah.
Gee, I can't imagine why either, because you have a bunch of dumbass psychopaths that follow your every word.
Any responsibility?
No, I don't. No, I can't imagine. I can't imagine that. Yeah, go ahead.
You can't imagine that. It's not whether you can imagine or not. It happened.
Mr. President, Dr. Anthony Fauci.
Why does it stop there? What do you mean? You can't end it with "I can't imagine."
Says that we need to increase testing by double
Night Period
at least, and so does the Rockefeller Foundation. When are we going to be doubling testing?
It doesn't really matter what they say there, and we just left him. We just had a meeting, but because we're going to have much more than double it very soon. Now, there are big believers in testing, and then there are some governors that don't feel as strongly about it at all. You understand?
No, I don't understand that. Who are these assholes? Name the governors who go, testing. What a bunch of bullshit.
They feel much differently about it, but
who? Ask him who. Ask which governors. Call all the governors and go, are you one of the people that the president says doesn't give a shit about? Honestly.
Going with maximum testing because it's something we're very capable of doing, but we'll be much.
No, we're not capable of maximum testing right now.
More than
anywhere.
Doubled. You know, Mike, I'd like you to answer that. We're going to be much higher than doubled on testing very shortly. Mike, please.
Seriously, I'm behind a cookout. It's getting windier than ever, or smokier than ever.
Yeah, please.
Clouds are rolling in. Oh, that's
Thank you, Mr.
Pence. Sorry.
I hope the American people looking on today are as proud as the President and I are of the incredible public and private partnership that you heard from today.
Yeah, I'm overwhelmed with pride. You know what? There's a public-private partnership between everybody and Netflix because we're all staying home.
It was 2 months ago that we had done less than 10,000 tests for the coronavirus in the United States.
Yeah. And that was terrible.
But because the president brought together these incredible commercial labs, brought together the best-known retailers in America. Now, Mr. President...
It's a pandemic.
5.4...
Just, Mr. President, thank you for not abdicating any... telling us to not do anything and allowing 2.2 million people today. I want to thank you for actually doing the bare minimum.
Million tests. And as you said earlier today, we've done more than 200,000 tests in a single day. As we met with governors today, I sense the enthusiasm among governors for the way that testing is scaling all across.
Yeah, see, there is smoke rolling through here. This is mist or something in front of it.
The country. And
see that?
We assured them on the call today that we're going to continue to directly partner.
They're giving this address upon the moors. Fear the werewolves.
With them to make sure that all of the resources you heard about today continue to be expanded. But I want to ask Admiral Giroir, who is literally working day in and day out with the governors, to describe some of the numbers for exactly where we will be.
Describe some numbers of exactly where we will be.
We're north of 5 million tests done now. It is remarkable to think of the pace of acceleration.
No, it isn't. It's remarkable that it's this slow.
But Admiral, maybe you could speak about exactly when we will reach the point that some of the experts say that they think we need to be at, whether that be 300,000 tests a day or 500,000 tests a day. But what's remarkable to me as a layperson, Mr. President, is because of this partnership you've forged, we're almost there. And
as a layperson who's not even allowed in 2 of the aisles at CVS and Walgreens because Mother won't let me. Anything that I can't even buy Lubriderm just because of the name.
Be there very, very soon for the American people. But everyone who is as anxious to see America reopen as this president and our entire administration are should.
You just drifted off. Did you see him fall asleep?
Know that the 3-phased approach that the president outlined 10 days ago.
By the way, the Pico mic folks are sending me a new receiver, so I'll be back to using my normal clip-on mic tomorrow, and we'll be back to full freedom of movement. I'm very excited. Yeah, there you go.
We believe, and I believe increasingly governors understand around America, that we have a sufficient amount of testing today for every state that qualifies.
He's not a shipping clerk, Edward.
To enter phase 1. To begin to reopen their economy.
To enter phase 1. Yeah, this is the part that they're still trying to sell to this asshole. 14 days lead up to whether you begin.
Mr. President, with your permission, I'll just ask Admiral Giroir to give some specific numbers about how quick, for all that we've done, how much more quick.
The Snowcat Brigade.
You'll see an expansion of testing because of the partnership that you witnessed again here today.
Thank you, Mr. President, Mr. Vice President. The number of tests that need to be done depends on the state level. You understand that places where there's high virus circulating will need many, many more tests. Places that do not have high virus circulating may need less tests.
Hey, hang on a second. Real quick, just a question. I don't know. I'm gonna let you finish, but real quick, how do you know how much virus is circulating or not testing? Right.
Let's just assume Dr. Fauci was talking about a 4 million per month number, which was sort of a week ago where we are. So we will, according to the governor's plans for next month, we will easily double that 4 million number. We will have over 20 million swabs.
No. You're not going to double the number. You're going to double the number that you have completed. That's not doubling the number that you're doing in a day.
We're going to send out?
Let's see. We did 5 million in 1 month, and we're going to do 4 million by the end of next month, which means 9 million tests. That's actually fewer tests. You're going down per month.
We will have over 15 million tubes of media. We have all the tests matched, machine to machine, in a focused area. We've gone state by state and understand that. And this
the T1000 is cybernetic organisms.
It's not even including what you just heard, the 5 million per month test by LabCorp and Quest, or the point of care test by Abbott, or all the other tests that are out there. So in May, we are going to be doing more testing in this country. And people talk about South Korea a lot.
Yeah.
The state.
But you know what they're not talking about? You know what state they're not talking about? They're not talking about, and you keep bringing up South Korea. They're not talking about Italy. Why aren't you guys bringing up Italy? Now, I notice you're bringing up South Korea, and that's the purple line. See that little purple line? That's South Korea. Now, theirs has started to level off their testing. Not only is it not going up, but it's leveling off. Now, why would it be leveling off unless do they just want their citizens to die? Or are they doing way better at tracing and quarantining people so that they don't have to test as many people? So testing isn't the key part of their mitigation effort. It's tracing where, you know, anybody who's had COVID and possibly been in contact with somebody else, and then they just test those folks, and then they've been able to bring their caseload completely down. Meanwhile, we are still on an upswing, and Italy is kicking our ass. But okay. Okay.
The states with the least amount of testing will double the overall cumulative number per capita that South Korea has done in 4 months, to give you that understanding.
Go ahead, John.
See that? South Korea, eat our dust. No, don't bring up Italy, though.
Sure, this sounds
Or Germany, for that matter.
incredibly promising. Walgreens, CVS with the drive-through tests, the diagnostics agencies. But we sat here in the Rose Garden back on March 13, and these companies were here, some other companies were here. By my count, only 69 drive-through test sites have been set up by the companies that were here. I'm wondering if you, and of course, Mr. Vice President.
That's his fault. This is fun. Look at this.
Back in early March.
Everybody look. That's whose ass is that? Is that your ass? Is that my? That's your ass. It's not my ass. Is that your? It's definitely not yours. Okay.
We did 4 million tests by the following week. We're just now got there in the last few days. So what have you learned about what went wrong? What's going to go right now? What lessons have you learned from the mistake?
We don't learn lessons because you have to make mistakes to learn lessons. I've always known what was right and what was wrong, and everything that I've done, even the wrong parts, were right. So tell him, Mike.
For the last, month and a half or so.
John, I appreciate the question, but it represents a misunderstanding on your part.
Oh, really? On your part, it's a misunderstanding.
And frankly, a lot of people in the public's part about the.
Look at
between having a test versus the ability to actually process the test. I mean, the truth was, when the president tapped me to lead the White House Coronavirus Task Force 2 months ago, we saw the production of lots of test kits going into the marketplace. But as the president has said many times, what he understood early on was the old system would never be able to process the tests at the massive volume that we would need in the midst of an epidemic. And that's why the president brought together these extraordinary commercial.
That was always, that's in the CDC strategic plan for pandemics anyways. That's what the DPA is for. There is no way you could have enough government labs nationwide to handle the level of testing you would need for the citizenry. It's not, it's ridiculous.
Labs that you've heard from today literally sat them down in the Roosevelt room.
Literally sit down.
And said, we need you to turn all of your energies loose on doing the kind of high-speed testing that would be necessary for us to reach the numbers we're at today. And so there was no...
No. The reach the numbers we need to get to that we aren't anywhere near.
No disconnect at all. There were lots of test kits out there, Admiral, and frankly, there still are today. There are literally millions of tests that could be run in the old-style, slow laboratory that is...
Stupid, slow laboratories.
Are still conducting tests.
Like the dumbest motherfucker that ever lived.
Today, whether it be at the CDC or at state laboratories. But what the president brought about with this public-private partnership has brought us to the point where we've done 5.4 million tests to date, and literally
to date. They love this number because they make it sound like that's how many they're doing per day. To date, not per day.
Just heard that by next month we could be doing as many as.
Now, everything I'm saying could be proven wrong if the CEO from Shanghai comes up.
2 million tests a week all across the country to give the American people confidence that we can reopen and get our economy moving again.
So when you said...
What a bunch of bullshit.
4 million tests 7 weeks.
Like he's pleased with himself. Like, that was a solid one. Did you see that? I pooped and called it a flower.
So you were just talking about...
I'm a genius.
Tests being sent out, not actually being completed. I'm a little confused.
John, I think precisely correct that in my first week on this job, we were informed that HHS, I believe IDT was the vendor, Admiral.
Oh, it's not my fault. I was just told something that was wrong, and HHS screwed up. Which brings us back to the first question asked. Why is Azar still in his position?
That had distributed 1 million, was distributing another 4 million, and we believe they did. But again, those were tests that, frankly, but for the president's leadership, we'd still be waiting on those tests to be done in many cases. Because they were tests that were designed to be run in the old laboratory model. But early on at the president's direction, we brought in these incredible...
They're still operating on the same laboratory model. All you did was scale up using private industry, which is what the DPA is for. It's just a bunch of the pharmaceutical companies jumped at the chance to do this with government subsidy. Asshat.
Commercial labs. We partnered with these...
You lying piece of shit.
Extraordinary retailers. And now we stand here today, literally...
Basically what Pence is saying right now is that Rite Aid, CVS, Abbott Labs, Roche, and U.S. Cotton would have told the United States and all of its citizens to go piss up a rope in the middle of a pandemic if Trump hadn't gently asked them to with his, like, tapping his fingers on the gun of the DPA, which he never used.
Day last week, more than 200,000 tests in a single day. About the time that we were making...
Yeah, using the large-scale testing, not the Abbott machines, which take 15 minutes.
Those comments, we'd done less than 25,000 tests in the entire country.
Yeah, because the response to the disease was late, and the conception of a test for it was in process.
We've met this moment with
If you'd have started that earlier, by the time you were doing 25,000 tests, you would have been doing 150,000 tests.
American ingenuity.
Math is dangerous.
With the incredible companies that are represented here, and we couldn't be more proud.
Well, then, of them? Sure, but you should be ashamed of your own response. Stop saying, like, we couldn't be more proud with what they've done. We're not talking about what they've done, asshole. That was a terrible, nasty question, and it was wrongly asked, and you were wrong about it.
Important to know, and this you can get from any other country, I think, if they're being honest. Not only do we have the most testing in the world by far, but we have by far the best testing. OAN, please go ahead.
Mr. President.
OAN, please. Yeah, let me bullshit really heavily real quick and then call on OAN before anybody puts a cork in my ass.
Thank you. As I'd like to switch gears and talk about General Flynn. There are reports circulating now that he may well be fully exonerated this week. If
OAN's exonerating Michael Flynn. Yeah.
If that were the case, is there any reason why you would not bring him back into the administration?
I will only say this. I think that General Flynn is a wonderful man. He had a wonderful career.
Yeah. Here's a great idea. Bring Mike Flynn back into the government during an election. Do that. Do that, please. Pardon Mike Flynn and then bring him back into your administration. That'll besides COVID-19, that'll choke up the friggin' news cycle of stories between now and then. Holy God.
And it was a disgrace what happened to General Flynn.
Really? What was the disgraced part? The part that he was acting as a foreign agent for Turkey, or that he was sublimating U.S. policy before he had the legal right or ability to do so?
What happens now?
Or just the lying and the hiding of money?
But what happened to General Flynn should never happen again in our country.
Agreed. So don't put somebody like that in charge of things that matter, and then they won't find themselves taking orders from an asshat like you.
Happened to other people should never
Thanks, James. Yeah, we're going to need a bigger cork for this dude.
Happen again in our country. What happened to your president of the United States should never again be allowed to happen.
I agree. You know what? One way we can solve that is if you stop being president. That would pretty much guarantee it. I feel pretty good about the chances of that. I think so. Thanks very much, James.
President.
I love that he's like, that should never happen. It's bad that the president is treated so poorly.
Please.
Mr. President, thank you. Today, one of your top economic advisors, he said that the U.S. is likely to experience a 20 to 30% decline in the GDP in the second quarter, the worst since the Great Depression. Do you agree with that assessment?
I don't know, but I can tell you the third and the fourth quarter in particular
are going to bounce back like crazy, and you've never seen anything like it. Never mind the fact that airplanes and places where people gather are the highest point of, or 68% of our economy largely. And so those will take months, if not years, to come back online at full capacity. And
going to be, I think, spectacular.
It's going to be great. It's going to go up like a rocket ship, that 1% rocket ship.
We were talking about it with the executives. I think we're going to have a phenomenal third quarter. Nobody,
Thank you, Connie.
Except one country can be held accountable for what happened. Nobody's.
One country? I'm guessing everybody else is judging their government's response.
Blaming anybody here?
And the like the most deaths and the least amount of deaths, like whatever the deaths are, it's all China's fault, not how. All right.
We're looking at a group of people that should have stopped it at the source. But so what happens in second happens in second. What we are doing is, I think you're going to see a big rise in the third, but you're going to see an incredible fourth quarter, and you're going to have
probably because you'll get kicked out of office and stability will return.
Incredible next year. I think you're going to have a recovery. Look, they were just telling me inside, and it's fact, I built the greatest economy with the help of 325 million people. I built the greatest economy, and
you built the greatest economy, and yeah. So, all right. What was the stock market when you took over? What was the stock market when Obama took over? What's the difference between those two numbers? Which number is greater?
History of the world. And one day, because of something that...
Because you got rid of the pandemic response team and basically blinded yourself to the potential for catastrophe, you allowed this to happen.
It have never
3.5 years into your presidency.
Never been allowed to happen.
But it did, because you sat on your own thumb and called yourself a lollipop.
We had to close our country. We had to close our economy.
To save the citizens.
Built it. We had the best employment numbers and the best unemployment numbers for...
Imagine where they would have been if the 2008 crash had never actually happened and the Bush administration hadn't pulled the rug under it out from it would have already hit this point 6 years ago.
Hispanic American, for African American, for Asian American, for...
And normally people, I think, who are incredibly lazy, all of a sudden they're working 2 jobs.
Everybody, best stock...
Imagine if they got a living wage and they'd only have to have 1 job. What a weird idea.
Market numbers. And by the way, the stock market was up very substantially today.
Yeah, you mean the disaster econ crowd is making money off this?
And people are seeing a lot of good things. A lot of very smart people investing in the stock market right now.
Yeah, and gold's taking a shit, and oil's taking a shit, and natural gas is taking a shit. Yeah.
It's at 24,000.
People are shuffling money from one area to another area. That doesn't make more money.
Approximately 24,000.
If you take $100 out of a dresser and you put $100 in the bank, just because you can see the $100 in the bank now doesn't mean there's $200 in the world.
And if you would have said, with the tragedy that this country had to endure and go through, with all of the death and the people that died and were so badly hurt by what happened.
What is happening? It's happening.
And you can only say God bless them. But if you would have said that our country would be in the position we're now, we're ready to move forward. We'll never forget loved ones. We'll never forget these great people that sacrificed.
Name one. Name one. I mean, I know you can name Kim Jong-un and you've talked about Boris Johnson. Name one American citizen off the top of your head. Even your buddy who you can't seem to remember his name. The guy in the New York real estate dude who died, who was in a coma, and you get this call that he was in a coma and then he died. Name one off the top of your head.
For a reason of incompetence or something else other than incompetence, what happened at a point where they could have protected the whole world, not just us, the whole world. But we had the greatest economy ever in the history of our world. And I had to
In the history of our world.
turn it off in order to get to a point where we are today. And now we're making a comeback. And I think we're going to have economically, from an economic standpoint, next year an unbelievable year.
Yeah. Nobody thinks we're not going to get out of this. Nobody thinks that we're not going to have a turnaround economically. Nobody thinks that eventually the numbers won't right themselves just like they did after 2008. The dumb part is that you're cool with how many people died because you didn't want to turn it off.
And I think that you're going to see a fantastic fourth quarter, and the third quarter will start
Yeah, I think the November election will, Biden will make people feel a lot more comfortable.
to build. But the second quarter, obviously, you're going to have GDP lack of growth. I'm looking at the head of Walmart. What a job Walmart's done in going through something. I mean, they were
Going through something. What do you think the customers feel, or the employees? Where are all those parking lot test sites?
doing yeoman's work, including getting us millions of
Thank you, Winaldo.
Really very, very protective outfits. And I mean, the job that Doug and Walmart did was incredible. Millions of outfits. And those are
Outfits. Outfits. Don't forget your personal protective outfit.
high quality. I've seen them. Those are high quality. That's what
Those are great. Not these cheap paper things. They're these expensive paper
we
things.
need. So people have stepped up to the plate. I think we're going to have a really good, I think it's going to start building. I think it's going to build fast. I think it'll be a tremendous
Merci, Templeton Zarat. Merci beaucoup.
tremendous comeback. And, you know, so I say, I built the greatest economy with all of the people that helped me and all of the people in this country. We built the greatest economy the world has ever seen, and we're going to do it again. And it's not going to be that long.
And this, I feel like he's going to walk out soon.
Okay. Yes, please, go ahead.
One more. He's going to get come on, go for a sweetheart. Come on, get us, you know.
Mr. President, opening up the country, how long will you keep up the travel restrictions for Europe?
Well, we're looking at that, and it depends on how long it's taking Europe to heal.
To heal. Because we're going to heal our land.
He is starting to make a comeback. I'm very happy to see that with my friend, the Prime Minister. It's tragic what went on in Italy and Spain and France and Germany, frankly. And
But I was an Indian reporter, so he means the Prime Minister of India. My friend, the Prime Minister.
every country over there. It's tragic.
Name all the countries in Europe.
But we'll be looking at what's happening in Europe, and certainly we want to do that. And they
we will be looking at it. You guys want to go look at it?
Want to do it too. They want to do it very badly. Yeah.
Do you have any update on Kim Jong-un's health? Have
Say
you
it.
gotten any update on Kim Jong-un's health? Has he responded to your letter from March?
On Kim Jong-un? I can't tell you exactly. Yes, I do have a very good idea, but I can't talk about it now.
Dead.
I just wish him well. I've had a very good relationship with Kim Jong-un. If I weren't president, you'd be in war. You would have been in war with Korea.
Really? We'd be in war with the guy who's in a persistent vegetative state right now?
You would have.
Hillary is notorious for starting wars with people who are in iron lungs.
In war with North Korea if I wasn't president. That I can.
Why? That I can tell you, because I talk out of my ass all the time. So what difference does another bullshit statement mean?
Tell you. He expected that. That I can tell you.
He expected war, and he knew when I got in, there'd be no way. He could test all the missiles he wanted to. He could just fire rockets over Japan. He could build his nuclear arsenal and triple the number of nukes that he has. He knew that. Whereas if Hillary came in, we would have stopped him?
I hope
you can't have that.
He's fine. I do know how he's doing, relatively speaking.
Oh. You do? I'm going to go with your tone of voice right now that he's not doing well.
We will see. You'll probably be hearing in the not too distant future. All right, one or two.
At the funeral, you mean?
More. Go ahead, please.
Ask me another question. OAN, please.
A question about the 2020 election. Yeah, you're likely
He's doing better than Mike Flynn. I'll just say that he's like
Democratic opponent Joe Biden recently suggested that you were considering changing the date of the election, that you might try something like that. That's my first question. The second
I
question
never
is,
even thought of changing the date of the election. Why would I do that? November 3rd. It's a good number. No.
it's a good number. That's why I'm going to leave it there. Not because it's constitutionally mandated, but just because I like the, go
I
ahead.
look forward to that election. And that was just made up propaganda, not by him, but by some of the many people that are writing little statements. I see all the time, statement made, you say so, statement made per Joe Biden. Sleepy.
Yeah, that's how an administration actually works. You craft your statements instead of talking out of your ass and yelling in all caps on Twitter.
Joe, he didn't make.
That's how you avoid misspelling Noble and Nobel.
Those statements.
Or council.
But somebody did. But they said he made it. No, let him know I'm not thinking about it at all. Not at all.
Yeah, we know you. This is to make sure you don't. Because now you're on record of not changing it. That's the whole point. One of the ways that you get Trump to not do something really shitty is you release a story that he's thinking about it, and he will push back out against it based on ego and go on record. It doesn't always work because he lies and then he doesn't give a shit later. But thanks so much. Yeah, he was being sarcastic. Yeah. Thank you, Teresa.
Okay, go ahead in the back, please. Please.
The Senate Intelligence Committee came out with the fourth installment of its report. It concluded that Russia interfered in the 2016 elections and there was not political bias. Do you accept its conclusions?
Oh, I don't know. I haven't seen the report. I haven't
You haven't seen the report. I can't think of any reason why they would.
seen the report. Yeah, please, go ahead.
President, nice to see you. I think you have a good...
What's a sargasm? Is that when you go... a sargasm? Is that when you go, oh, that was great?
relationship with North Korean leader Kim Jong-un. But last Saturday, Senator Graham, he mentioned in the Fox News he interviewed, he said...
he didn't say anything last Saturday.
Kim Jong-un
Nobody knows where he is, so he obviously couldn't have said it. If you have a...
Well, maybe if you don't know everything, and that's what you're telling us, then he could have had an interview that you didn't hear about if he's alive, but you sound like you're talking about a dead guy.
This is breaking news.
Yes.
That Kim Jong-un made a statement on Saturday? I don't think so. Okay.
Because he's been dead since Wednesday. There we go. There, all right, that's all. That's it. Just slipping right out.
Hey, go ahead. Let's do one more, please, in the back.
In the back. That's where the
American president loses
OAN.
more Americans over the course of 6 weeks than died in the entirety of the Vietnam War. Does he deserve to be reelected?
So, yeah, we've lost a lot of people, but if you look at what original projections were, 2.2 million.
If you did nothing, which is an option with me, most of the time I do nothing when it concerns the lives and welfare of other people.
Probably heading
unless it makes me look good.
60,000, 70,000. It's far too many. One person is too many for this. And
apparently not, or you wouldn't be okay with opening.
I think we've made a lot of really good decisions. The big decision was closing the border.
The big decisions was the states telling you to piss off and handling it themselves.
Or doing the ban.
We'll bend the curve. Don't call us. We'll call you.
People coming in from China, obviously other than American citizens, which had to come in. Can't say you can't come in. You can't come.
No. It wasn't just U.S. citizens.
Back to your country. I think we've made a lot of good decisions. I think that Mike Pence and the task force have done a fantastic job. I think that everybody working on the ventilators, you see what we've done there, have done unbelievable. The press doesn't talk about ventilators anymore.
Because the treatment for the disease has shifted over time, and the states went and solved the problem on their own. They know not to rely on you. No one asks you. You know who talks ventilators every day? Cuomo.
They just don't want to talk about them, and that's okay. But the reason
no, he did not lower the flag for 50,000.
They don't want to talk. That was a subject that nobody would get off of. They don't want to talk about them. we're in the same position on testing. We are
we?
lapping the world on testing, and the world is
lapping the world. I mean, if you mean your tongue on Italy's ass.
Coming to us, as I said, they're coming to us saying, what are you doing? How do you do it? And we're helping them. So, no, I think...
How do you... Yes. How do you do it? It would be very helpful for us if we found out what you are doing so we don't make the same stupid fucking mistakes.
You've done a great job. And one person, I will say this, one person is too many. Thank you all very much. Thank you. Thank you.
Why does Maryland have to go to South Korea to get 500,000 tests?
Did he just leave the CEOs out there? It's just like Pence pulling the door closed behind him. Nope, there they go. They all get to go inside. Lovely. Well, that was extraordinary. Oh, criminy. You know, look at that. It's a serious. Can I say for the record? Let's see. Yeah. So this is the earlier thing I was telling you guys about. It's only 4 minutes, so we won't be here a long time. But this is Trump giving. This is when they were setting up the camera. It looked like he was saying, "Love you, everybody," and I think he was saying, "Hello, everybody." I think that more is made out of that than need be. But this is his statement from that moment, and the ending of it, I think, is the sweet part. This is it.
Americans at retail.
By the way, you know how sometimes my audio's on one channel? That's their problem today. They're only in the left side for whatever reason on their live feed of this situation.
Locations across the country.
So if you can't hear it, let me know, but it's in the left side.
And especially in our African American and Hispanic communities, we're going very, very strong in those communities. There are currently 73 retail sites, testing sites in 25 states in those specific areas, and we're increasing.
That's the 22% we heard about of the 110.
Very substantially. A lot of progress has been made for.
Where? All of them in Georgia and Michigan, because you need Michigan to win, and Brian Kemp?
African American testing, Hispanic American testing, and Asian American testing. So I look forward to hearing from each of these incredible business people who have worked so strongly with us right from the beginning. I think of it, it was only 45 days ago that we got together, and so much progress has been made. I thought
donor.
Maybe we'd go around the room and they'd say just a couple of words, and then we're having a news conference in the Rose Garden because we have a lot of these folks are going to be joining us, and they'll say something out there. They've got a big gift to our nation and to the people from.
I see. He said this earlier. This was before. This is before the Rose Garden thing. This was earlier today, and he goes, "They have a big gift for the people," and I don't know. I was expecting something on those screens to show that they're going to be donating some big thing, or there's an organization. Honestly,
some of the companies, and I appreciate it. Maybe we'll start off with a very small company, a very small little retailing company known as Walmart.
Get it? Because it's huge, and because most of their stuff comes from China, and you could almost stack our entire trade deficit at their door.
Headed by a great guy, Doug, please.
Hello, Doug McMillan.
Doug, please. That's his name.
Walmart. Nice to see you.
Doug Walmart.
Larry Marlowe, CVS Health.
Steve Bruskowski, Quest Diagnostics.
Richard Ashworth, Walgreens.
Mark Casper, Thermo Fisher Scientific.
Mark Casper is always blocked by something. Poor guy. That's Azar, by the way, right in front.
Rodney McMullen, Kroger.
Kroger.
John Nims, U.S. Cotton.
Hayward Donegan, Rite Aid.
Hayward, not Haywood.
Okay, and we know this.
And you all know who this guy is, huh? Come on, give it up for the human Q-tip himself. Mr. Swab, I like to call him. Rico Suave.
Right.
That's a nice suit.
So tremendous progress is made, and we'll be talking to you in a little while out at the news conference. Mike, would you have anything to say?
Well, just a word of thanks, Mr. President.
Oh, my God.
It's remarkable to think you speak about 45 days ago when we brought many of these retailers together with these remarkable commercial labs. And
CVS and Rite Aid and Kroger's aren't commercial labs?
we build on a public-private partnership that you forged early in the...
Wait, what you don't understand, Mr. President, we're going to be doing tests right in between the meat and veg. You know what I'm saying? You just come into a Kroger and we'll give you like right between the meat and veg. And by that, I mean your taint.
Coronavirus epidemic. Mr. President, when we first sat down at your direction with these great commercial labs on March the 4th, our country had conducted...
Hold on. Wait. I have to do something. Hold on. Give me a second. This might fuck everything up, but it'll be worth it long term. Trust me on this. This will be worth it. It'll take me a second, but we'll see. Hold on. Hit. Whoops. There we go. Almost. Almost there. Hit. Wait for it. Wait for it. I have to go to just me for a second. And then transition and then back. Because it gets squirrely whenever I'm messing around with this in the background. If I try to switch back from the pages, it gets a little funky. So hold on. We'll switch back to this. Hopefully it works. Oh, come on, you rat. I know this is a waste of time, but it's for me. Just enjoy. Hold on one second. There we go. Come back, you bastards. There we go. That's better. Please continue.
Roughly 25,000 coronavirus tests.
Are you smelling my shoulder?
Today, that number is 5.4 million.
Wait a minute. So, you've only done 5 million tests this month? You said, didn't you say 25 million by this time? To quote my pimp, you short. Stop sniffing my shoulder.
And with the support of companies like CVS Health and Walmart, Walgreens, Target, and others, we're now...
Come on, dude. Not while Pence is talking.
Scaling that, working with governors as they implement their testing plans. And it really is what you said early on, Mr. President. This is a whole of America approach.
Oh, don't say whole. Mother does not approve. He said whole.
You brought all of America's best together. Our retailers brought together our commercial laboratories, and the results speak for themselves. As we heard in the call with the governor.
Using the whole fist, Doc?
Today, governors are rapidly expanding testing across the states as they move toward a phased and responsible reopening of their state and this nation's economy.
You don't think anybody notices?
I'm glad to be back with this group, Mr. President. I know how
I'm sorry, Mike, go ahead.
grateful you are.
You're being so gracious and grateful to him, and he's just sitting over here breaking wind.
Collaboration around this table, and I look forward to hearing how we can continue to build even more momentum in the progress.
If he builds any more momentum, he's going to be ejected out of his chair.
Come we're making on. As a nation, working with these great retailers and working with these extraordinary commercial labs that have done so much for America in such a short period of time.
Thank you very much, Mike. We'll see you outside at the new.
Oh God, that's just hideous. How does anyone even survive in these meetings with him? I don't, honest to God. Hold on, I'm repositioning myself and then we'll go again. Hopefully it won't black out the screen. It does sometimes, but what are you going to do? It's all right. Here we go.
Conference. Thank you very much. Thank you.
Now watch this. Watch this as everybody leaves. Watch everybody leaves. Hold on. Wait. Hold on. I got to shrink myself for this one a little bit. This is not gonna. There we go. Hold on. Hold on. There we go. Get out! Get him out of here! Get him out of here! Oh my God! I can't, I'm falling! I'm falling! I can't take it! Look at that! They just shuffle everybody out. They don't even have time to turn off the camera. Look at here. Watch this in the hallway. Watch how I think the Secret Service dude, or at least one of the aides. I think that's Secret Service over on that side over there in the gray suit. The blue suit dude seems to be staff, and he's pointing which way people are, like, it's like the dude in Bachelor Party. Hookers on the left, drugs to the right. Get out of here. So that was that. Yeah, that was the end of that. That was fun. That was a good. I think that works. I think we should try that more often. Just insert me in the process. That'll be a good time. I just have to do a little bit of prep ahead of time. See, the problem is doing it, on the fly, right? When they're, but I should say, let's see. I guess probably I could. Yeah. That's. I gotta say though, what I would not give to sit there in that room. Honest to God. Oh God. Yeah, green screen theater. No question. Oh, it's gonna be so much fun. I think that but yeah, they're just like, get out of here. Press. Come on. Go. Go, go, go. Get the hell out of here, people. You do not deserve this man. He worked so hard for you. And you don't even appreciate him. What's wrong with you? You people are terrible. Thank you, Christine F. I added sound effects since last time. Which I think is an appropriate one. If you're ever wondering what people think about me.
Sportos, motorheads, geeks, sluts, bloods, wastoids, dweebies, dickheads. They all adore him. They think he's a righteous dude.
So, thank you guys so much. Have a lovely night. It was really nice hanging out with you. I'm glad we got another one of these. I have a feeling. I thought they were gone for a while. I got to be honest. I was in my head like going, maybe we have to, shift to a different format for the show or something along those lines. I don't know. Because, there was a chance he was actually going to shut this thing down. But, yeah, I think he's going to be back tomorrow. I'm going to guess. Because I think he likes the pushback, and he's too stupid to like, head for the hills when he knows it's, when he knows things aren't going his way. So, yeah, you guys have a great night. I will talk to you later. I will, now that my setup's working a little bit better and not, sorry, I had a phone call in. No problem, Andrea. Andrea, beg your pardon. I was already going through withdrawal. Oh, thanks, Cosmic Rose. Thank you guys so much for the super chats today. Thank you for the Patreon support. Don't forget to like and subscribe. Hit the notification bell so you'll know when we come online. Because they're always. I wish I could schedule this. When they say they're going to schedule it, but they always change it. So, and I will check my Twitter. Thank you, Philly, Dana. And so yeah, subscribe to the channel. That really helps us out. Pass it around, share the show, let people know about it. We will be doing this as long as they do that, and we will. And Richard Custer, Patreons assemble. And thank you guys for your Patreon support. We're going to be having. I'm going to give Get Vocal a try. So and then I'm going to be on Ileana Douglas's podcast on Thursday at 3:00. I don't know if she puts it out live or not. I'll let you know. And then on, let's see, we have something else tomorrow night as well. So I will let you guys know about that. It's in the schedule somewhere. I just got asked to do it, and I don't know if it's for sure. And then, of course, May 1st is the Queer as Folk get-together. Follow Scott Lowell on Twitter if you want to know about that one. He's at Scolo, at SCOLO. and I will also put up all that stuff as well. I thought it was kind of a good idea to have the total tests per capita running, because even I had to check to make sure that, because I was starting to go, are we number one in the world? We must be number one in the world. He says it so often. And of course, it's a lie. Yeah. But I will see you guys tomorrow. Have a great night. You guys are fantastic. I will see you soon. Take care of yourself and take care of somebody else.
Just the facts, ma'am.
A chat with you and somehow death loses its sting. Shut up and never say anything again as long as you live. Moon River.
Once it was reluctantly aroused. It was hard to get it aroused, and it is hard to get it aroused, but we got it aroused.